on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mego, the best family shopping experience. Good morning, good morning, good morning, and welcome to another episode of Health Vibes. Your favorite Jolly's team is on with you this morning, as usual, on a Wednesday morning here on the airwaves of Q95 FM radio. Good morning to you, our listeners, our loyal listeners, our first time listeners, and our listeners who are maybe a bit sometimes ish, but we are aiming to get you to be the constant listeners that we want. Good morning to all of you all. Leona, good morning to you.
Good morning to you, Trudy, and good morning to all our listeners. Of course, like she said, we're hoping that we're here every week, back on Health Vibes to basically bring you the vibes.
Yes, a health talk show with a little vibes, a little excitement, a little energy. That's what we always aim to bring. But Leona, it is a very hot Wednesday morning.
Indeed.
A very hot Wednesday morning. But it is the hurricane season. So we are keeping our eyes on the Atlantic and, storm development. There is a tropical storm that has formed in the Atlantic area. Not supposed to impact us, but you can never tell. So
Right.
we still have to keep our eyes on the systems. Hurricane season is a time for preparedness, and for keeping alert. So I do hope that that is what our people are doing. Always just keeping prepared. I don't know what it's like for you, Leona, but in the hurricane season, for me, it's anxiety time.
It's definitely anxiety time. My Maria experience was filled with that. A bit of anxiety, a bit of shock for sure. But with that experience, I think we grow and we learn. So now, whatever errors we might have made, if we didn't have enough batteries, if we didn't save enough water, these kind of things, do it. And we don't want to wait for when a storm is coming, because sometimes the water might be dirty before the storm gets there. All of these things, you need to prepare, give yourself time so that you're always ready. Maria was 1 to 5 in a very short time, right? Space of time. So you want to make sure that you're prepared and ready for anything that may come our way.
Definitely. And I do know at Jolly's, you all are well equipped to assist with preparedness. We always advise people on Health Vibes, for the years I've been on this show, to make sure you get your first aid kit, for instance, your medical supplies that you may need to prepare yourself in terms of your health and wellness as well. So not just the food preparation, but also preparation in terms of health and wellness.
And lucky you mentioned this, because we often get persons, if a storm is coming on Friday, we get everybody rushing in on Thursday night, trying to get your meds, trying to get, give yourself some ease. We don't need added anxiety for the persons that are like us. So if it is that during the periods of the hurricane season, maybe you ensure that you have an extra month or 2 weeks of your basic medications, that's your prescription medications, as well as any other supplements or so on that you are taking, that you also come in and, like she rightfully said, first aid kits. We never knew we would have that much damage after Maria. And so we had a lot of cuts, bruises, shattered glass, all of these things. So you ensure that you get a first aid kit. And at Jolly's, we have different sizes. We have the corporate kits. So if it is that you want to get a corporate kit for your company, you can contact us. We can build it to your liking.
To your own specifications,
right?
You can provide
so that can be done as the bigger kits, and then you can also come in and get ones that are already ready and available on the shelves.
Nice.
For bigger families, there's smaller ones if it's just yourself, and of course you can get a little nice kitty wrapped one for your children. To make the experience a bit more soft on them if they do need to get first aid treatments.
Okay, nice. So you can get all varieties of first aid kits, even corporate size.
individual size, family size. That's good. So to our listeners, I mean, we're just, giving you some good information here. We are approaching the peak of the hurricane season. So get yourself prepared. And Jolly's Pharmacy is the place to do so if you require those first aid kits, those medications that you may be on, you want some advanced supply. This is the perfect opportunity to get yourself ready. I like to advocate for preparedness because I think it helps obviously with reducing that anxiety that you will feel. If you are prepared, the anxiety is a little less.
Right.
Yes, the anxiety is a little less. I do see we have our online viewers, those logging on to the Facebook page of Q95 FM and the YouTube channel. I see we have our listeners coming on. I'd like to wish you all a particularly good morning. I see some of our regulars on. Julie is on. Good morning to you. And I hope that the rest of the crew joins on social media. We do have a guest lined up for this morning's episode. But Leona, before we even break to go into that aspect of the show, I know there's something big happening in the pharmacy world that I know you want to talk about.
Right.
That's happening this month?
This month and next week.
Next week? Oh, okay. It's soon. What's going on?
Well, basically, what we're having next week is a culmination of all the pharmacy minds across the region coming to our island for a conference experience. So we will be hosting the Caribbean Association of Pharmacists conference next week, and that's new in the pharmacy world. So that comes from the Dominica Pharmaceutical Society, and that's a culmination of private and public pharmacists who have come together to build a team to ensure that pharmacy remains a big priority for us. Proper practicing, proper bills, all of this. We had the bill go through a couple years ago, I believe. So these are things that are following up from the changes and the advancements that we want to make in pharmacy in Dominica. So the Dominica Pharmaceutical Society will be hosting the Caribbean Association of Pharmacists Conference 2025 here in Dominica. During that conference, we'll have pharmacists and pharmacy students from all over the region, Guyana, we'll have from Jamaica, all of these places. So all over the region that you can think about coming here to basically go through a conference of educational value. So we'll be doing a lot of continuing education, with actual studies and these kind of things, proven published works that we can disseminate to each other and learn from each other.
Okay,
right.
So it's I assume a good networking experience
it
as
is
well.
Indeed
for pharmacists.
As well a great networking experience for pharmacists across the region. Some of these pharmacists are business owners, some of them are in the public sector, all of these things. So when it comes to making pharmacy across the board better, these are the persons that we want to affiliate with and all of that. So it's a good networking opportunity for us, as well as a good tourism opportunity. So for persons who may have, you have your businesses or your stores or whatnot, look out for these large groups of people. And if you see them, say hi, try to speak to them and get them to understand how lovely that our island is. We'll be trying to do, some tours on the West Coast as well as in the Valley, to get them integrated and get them back, of course, on island.
So what is the length of the conference? How many days will the participants be on island?
The conference spans from next Monday, so that's the 18th, all the way up to the Sunday after that.
Okay.
So they'll be here for a full week.
Okay.
Right. And some of them are obviously coming in a bit earlier, so we should have persons on island from this week, as well as some who would be staying after. Some are bringing their families. So we're getting good opportunity to integrate with the rest of the region pharmacy-wise.
Nice. So I know all the Jollies pharmacists will be on board.
Indeed, we are all registered and ready to go.
Okay.
Ready to learn, whether it be, and we'll still be there to serve you, of course. So some of us, if we cannot be there physically, we will be following up online because we really want to get that information and so on, so that we can keep advancing ourselves. That's what we aim to do, continuing education mix for better experience where medical health is concerned.
So I know the listeners may be saying, boy, they're going to be engaged in that conference. Who is going to be at Jolly's Pharmacy
we will
next
be there.
week?
Your regular faces will be there and I'm ready to serve you as well.
Yeah, so have no fear. The conference for pharmacists, Caribbean Association of Pharmacists conference will be going on from the 18th, but the team at Jolly's will still be there to serve you. So have no fear about your Jolly's team. They'll still be on hand. Leona, I know the preparation must be very taxing on those who are involved in organizing, and so I really wish all pharmacists and everybody participating a very great conference. I hope everybody can get something out of it that
Indeed.
is memorable and that they can take back for a very long time. Yes, so let's take a quick break, and when we get back, we should be introducing our topic and our guest for this morning. As I said to you, we do have a special guest lined up to be with us in studio. And this morning, we'll be talking about something actually, Leona, that we have never spoken about on Health Vibes before. So stay tuned for that. We're taking a break. We'll be right back.
Introducing Jolly's Pharmacy, brand new website. www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.jollies.gm. Jollies Pharmacy, leading the way in healthcare. We got this morning feeling risky. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. And don't you touch Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work and pick on any mission. If you see me again, Jolly's Pharmacy is number 1. Jolly's for you. We cater for everyone. Jolly's for you. It's the immune system. Jolly's for you. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if the same convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. If you got to leave your social, it's to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. It's to everyone. What a happy place. Oh, what a happy place. Just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia, where there's lots of parking from Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Introducing Jolly's Pharmacy, brand new website. www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.jollies.gm. Jollies Pharmacy, leading the way in healthcare. We got this morning feeling risky. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. And don't you touch Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work and pick on any mission. If you see me again, Jolly's Pharmacy is number 1. Jolly's for you. We cater for everyone. Jolly's for you. It's the immune system. Jolly's for you. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy. They boost me up real quick. Johnny's Pharmacy, leading the way in healthcare. Introducing Johnny's Pharmacy, brand new website, www.johnny's.gm. It's your time to jump the line. Shop now at johnny's.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Johnny's.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.johnny's.gm. Johnny's Pharmacy, leading the way in healthcare.
Oh, but if the convenience will make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun, shop. If you're not happy, if you're so shop. It's a to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun, shop. If I don't know how long, shop. It's a to everyone. What a happy place. Oh, what a happy place. You just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia where there's lots of parking from Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Woke up this morning feeling risky. I had been vicious and calling sick, but I end up in Johnny's Pharmacy. And don't you got treat and it's some my immune system. Me feeling fit and strong now. I'm ready to work like it on any mission. If you see me again, Johnny's Pharmacy is number one. Johnny's for you. We cater for everyone. Johnny's for you. Boost up the immune system. Johnny's for you. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy. They boost me up real quick. Johnny's Pharmacy, leading the way in healthcare.
Yes, and we are back with you. I hope you didn't think that we were not coming back. Of course, we are here with you. This is Health Vibes, and we are gearing up this morning for a topic, as I said before the break, that we never have spoken about before on the program, at least since I've been on the program, which is a few years now. Never remember speaking about this in particular. Our guest is on his way. We are expecting Dr. Irvin Pascal, affectionately known as IP, to be joining us in studio in a few minutes. He's on his way. But this morning, we're really going to be delving into the whole aspect of what keeps us balanced. And there is a particular organ that's involved that I don't feel like a lot of people even attribute their balance to this part of their body at all. And Dr. Pascal, when he comes in, he will be best poised to guide us through some of this because he's an ear, nose, and throat ENT specialist. So this particular organ is under his specialty, and it's related to balance. Leona, I want to know, I don't experience it, but I want to know if you experience any dizziness or feeling of unease when you are in a vehicle, a plane, a boat, any motion, unease from you when you travel?
I don't believe so. What I will say though, if I'm on a ferry, that's fine. If I do go below deck at this point, then I may experience some imbalance. But generally, motion sickness doesn't affect me as much.
So generally you don't. I don't experience it as well. I know though quite a few people are queasy or dizzy or sick when they are traveling. There's some people, it happens to them in vehicular transport. So they're in a vehicle, they're driving long distances. Some people on that airport ride with all the turns and twists on the route to the airport, they start to feel sick.
Very much so.
There's some people from the time they hit the boat, they start to feel sick, so they get that aspect of motion sickness, and some people even on an airplane. So
not to be confused with anxiety, though.
No, not anxiety, not anxiety at all. But yeah, some people do experience that type of, that level of queasiness or dizziness or, sickness. So a lot of people wonder, but why? Like, what's causing them to have those particular feelings? We do have our guest. We do have our guest in studio with us right now. And as I said, he's best suited to speak to this because of his specialty. Dr. Pascal, good morning to you.
Morning.
Good morning. I don't know if I should have given you a few seconds to.
No, that's fine. I'm fine.
Okay.
Just a sign of my age that I have to. Normally, the last time I was there, I ran up this step and I didn't have any problems. Now I realize I run up these steps and
yeah.
So that means
that's
either been a long time I haven't been here or I'm not as young as I used to.
Well, I mean, there's some of us who are younger who cannot run up the steps. Who can? I mean, I am ashamed, but running up the steps has never been an option for me. Leona, maybe you?
I'm getting the same place at this point.
I slowly walk to come up the steps of Q95. But Dr. Pascal, I am happy to have you on the program. Mm-hmm. We were just, and I feel like you're a guest that needs no big introduction on this platform because people know I said IP. People know IP. So I feel like, you are very known to our audience. And so they know when I say IP was coming, they know who we're expecting. But I was just asking Leona if she experiences any sort of sick feeling when she travels. Mm-hmm. She said no. I also don't experience any sort of motion sickness, but I do know that quite a few people do. We were just talking about how the airport route is one that sometimes gets people feeling very sick because of the turns and twists. And a lot of people wonder why. Why does that sort of movement cause them to feel sick? I'm seeing one of our viewers asking if this feeling has something to do with our equilibrium. So big word there, but Dr. Pascal, I know you well poised to tell us why do we feel weird sometimes when we're in motion.
Okay. Greetings to you and Jollies and DJ Shan and the public. It's been a while I haven't been in the studios. First, I'd like to apologize for my tardiness. So try and compensate for that. So I won't be leaving early. I'll try and spend the whole hour.
Okay.
I didn't plan to. So anyway. Right. That's a good place to start because it starts with something that I hold dear, and I heard you talking about it when I was driving in, which is prevention and understanding prevention and wellness. And prevention is always better than cure, and the best way to prevent is to prepare. So I want to reinforce that approach that I heard on my way here. I like to say as well, all treatment starts with prevention. Okay. So whatever I go to treat, I like to start with how you prevent it in the first case rather than having to treat it. Okay. So it goes back to the old, well, we like to call it the old, but our forebears that prevention is always better than cure. For everything, especially when it comes to health and health issues, especially with the cost of treating these days. So I just like to reinforce that from the outset.
Prevention is better than cure.
Yeah. The motion sickness. Well, that's a good place to start because you wanted me to start with vertigo, and vertigo is always a issue. So
we'll go into that.
So it'd be a good place to start to introduce what happens during vertigo.
Okay.
simplest way I can explain this is to talk about, well, you mentioned it, equilibrium and balance. How do you maintain your balance or your equilibrium in relation to the space around you? And to do that, you need, everybody has an idea of how things work. You see something, you feel something, you taste something, you have your senses that capture those realities, and then it goes up to your hard drive, and this is your brain, and your brain organizes it and makes sure you feel okay, basically. So for balance and equilibrium, it depends on, and balance meaning, and equilibrium meaning like how you feel in relationship to sort of time and space.
Okay.
Meaning, but more so for us, we say space. So what happens when you have motion sickness? There's an alteration in your relationship to the space around you.
Okay.
And why that happens is because for you to, when you walk and you feel balanced, firm on the ground, my equilibrium is good, it's because you have information going from the bottom of the sole of your foot up to your brain. It's also that you have information going from your joints up to your brain. It's also that you have information going from your ears to your brain. It's also that you have information going from your eyes to your brain. So for equilibrium and balance, you get input from all these sources that then goes up to that information, or you could just say the upload, and we're talking modern technology. All that information is uploaded into your brain, and then your brain coordinates all the information and lets you know you're okay. In time and space, you feel stable and you feel well equilibrated. So that's the basis. So it's when you have a disruption of that information and the brain coordinating everything to tell you, well, yeah, you're looking straight ahead at the road is not moving. The road is not moving, so that information from your eyes goes to your brain, but also your ears, the balance organ in your ears also is sending information that you're turning right. So your left ear will send the opposite message from your right ear. And that type of thing. And your joints will tell you, well, you're not walking, so your joints will tell you, yes, I have to bend my knee so that I can sit in the car. So information as to where you are in relation to the road goes up to your brain. So when you have motion sickness, it's usually because you have either you have an acute sense of the messages are coming so fast, so it doesn't give your brain enough time
to integrate
it, and you feel like you're not sure where you are because you're driving on that day wash road, you turn a corner, you're worrying about. So that's information. So if you're not processing it quickly, or if you have a sort of hyper ability to process, some people are more sensitive than others, then you will notice the difference. But if the messages as well aren't coming quickly enough from your ear to your brain, then you have a processing issue and you feel out of equilibrium and out of balance. And but it's one system that's coordinated with your nervous system. So information also is going to your stomach. So that's why you feel nauseous and want to vomit. So that's why they will end up giving you something to help you just to treat the symptom. Might give you something like that doesn't make you feel like you want to vomit.
Okay, so that's where the gravel
that's
comes
where the
in.
gravel comes in.
Okay.
That's where the gravel and the other medication they give you to put behind your ear or that type of thing. That's where it comes in.
Okay.
So it doesn't do anything up here. It just keeps your stomach under control so that you don't end up vomiting all the time. But some people, they're very sensitive. Like, some people don't like you putting anything in the back of their mouth because they get what you call a gag reflex. So those people with a sensitive gag reflex are the same people who will tend to
want to
because they have a sensitive system from their mouth to the anus.
Okay. So I already see we have a call coming in. I really wanted to know though, we'll take this call, but I wanted to know, let me just pin that. If you cannot be prone to motion, you've never had motion sickness before, and then all of a sudden you just start experiencing it.
Yes.
That's
that
possible.
happens, yes.
Okay, let's take this call. Caller, good morning.
Good morning, Judy. Good morning, everybody.
Hi, good morning.
And good morning to my favorite doctor. I've been sending hello to him. I'm not hearing him, but today I'm hearing him, so I'm happy.
Happy, nice.
I was out. I just want to know what really are you talking about. I'm hearing the conversation, but what is it really are you talking about?
Okay, so Dr. Pascal, you got a greeting there, and let us put our topic in context. So this morning we focusing on everything to do with balance and the association with the ear. We started by talking about motion sickness. So that's what the doctor was speaking about, motion sickness. Why do we get motion sickness? What is the cause? And the question I just asked is, can you not have motion sickness all your life and then all of a sudden start experiencing it?
Yeah, that's a good place to start as well, because take for instance, if you young people don't know that anymore. I don't know what's the equivalent of it. There used to be a thing called, by the way, the DPSU is now called the merry-go-round.
Okay.
And if you go on the merry-go-round and you spin, then you get motion sickness as well.
Yeah.
You feel like the place is spinning after a while when you stop, and then sometimes you feel nauseous. But for years, you've been going on the merry-go-round and it never happened. So it's the same way. So all of a sudden, whether it's because of different reasons, age and so, but you might find that things you could tolerate when you were younger, it's the same processing as well. All of a sudden, you find, well, I'm not processing them as well. So I think it's just a matter of processing. It doesn't signify any pathology.
Okay. So it's not something that, a disease condition could be linked to. Okay.
No, not I know of.
Okay. Yeah. Okay. I see we have another caller. Let's take this call. Caller, good morning.
Good morning. I call him from Marigat. I just want to tell Dr. Pascal. Dr. Pascal, this is Mrs. Musgrave. Good morning. How are you? Come up by the river for this year, Dr. Pascal.
Greetings, Mrs. Musgrave. I'll take note.
Come up.
Okay.
Invitations going out to the doctor this morning. But Doc, I wanted to continue on this vein. Some people know not in motion and feel dizzy, not balanced, and it's a particularly debilitating feeling for some people, and they experience it frequently, and that's where I wanted to then head into what is going on with these people who are perpetually, it seems, out of balance. What's going on with them? I see our lines are lighting up. Let's just take a few more calls. Caller, good morning.
Hello, good morning. I'm listening, and in case I don't get a chance to call, I just want to tell Dr. Pascal, good morning. How are you?
Greetings, I'm fine.
Love you, Dr. Pascal.
Thank you very much.
Thank you. Yes. Okay. So yes, Doc. Okay. Let's take this one more. Caller, good morning.
Good morning, Tuti. Good morning, Dr. Pascal, and whoever the other lady is there with you.
Leona is there.
Good morning.
Yes, good morning. I never used to have that issue before, like getting upset when I go and I travel. Especially the first time that really happened to me, as you said, Tuti, the Marigot Road. One early morning, we were traveling, and I just had to get out of the bus because I started puking. And I've never used to happen to me when I was younger. And lately, every time we go down that road, I always have to get nauseous. So before I leave, I have to drink a ginger tea. If I go down to Portsmouth, no, I don't feel that road. I feel all you turning, the winding, the bending, when you see you going up that area there, I feel that affected me real bad. What really causing that, I don't know. I used to suffer from inner ear They call that, but you call that, Dr. Pascal?
Vertigo.
Yes, I suffered from it in the 80s. And I used to be walking like an old woman because always I go in, one of my children had to help me, to come down with me, to walk with me because I was going off balance a lot. But then doctors, so that was what I had. But now and then maybe I still feel that way. So I try my best to stay out of the traffic way because I'm getting young, I getting older. Have a blessed. Nice listening to you. Bye-bye.
Thank you.
Thank you. And Blue Blue is going directly where we were going, you know, that feeling of unbalance. She's saying she has experienced and vertigo. So that's where we were going actually, Dr. Pascal. What is the deal now on that feeling for people?
Okay. As I said, we always have to go back to the basics and remember that wellness and your body is always functioning to keep you well and what we call normal and stable. And when it comes to balance and vertigo and dizziness and all those things, it's usually some loss of that normal coordinative activity that brings these symptoms on. And as I said, symptoms, I just like to, from the beginning, point out to the listening public that vertigo is not a diagnosis, it's a symptom. It's like headache, it's like fever.
Okay.
And I'm saying that because I know a lot of people come to me and say they've been diagnosed with vertigo, but vertigo is a symptom.
This is a big learning moment for me because I always have heard it spoken about exactly like that. Oh, I have vertigo.
Yeah.
Like it is it's a disease.
Right.
So it's a symptom.
It's a symptom. And most times people say they have vertigo from a physician perspective. They don't have vertigo.
Right.
They rarely mean they're dizzy. People, so you see, dizziness is a broad term that encompasses vertigo, which I'll come to in a while, but it also compresses being unstable when you walk. People say they're dizzy or they're off balance. So off balance, lightheadedness, feeling you're going to faint, all of this comes under dizziness. So dizziness is a broad term. Vertigo is also a symptom that sometimes is included in dizziness, but it's actually different from dizziness. Vertigo is usually an experience. What you experience is that there's, just like the motion sickness, there is the patient experiences disorientation in time and space. But you actually feel the environment is going around you, or you are going around. So when you go to the merry-go-round and you stop it, or these fancy new things they have, and you stop it, you feel that you're going around, or you feel the space is going. That's vertigo. So that's separate and apart from dizziness. So vertigo is a sensation that the room is spinning with you, or you are spinning with the room.
Okay.
Now, what? Go ahead.
Doc, let's just take this call. I see we've been okay. The caller has been trying. We will get them back. Caller, good morning.
Yes, good morning to everyone. Dr. Pascal seems to be the celebrity. Everybody calling more or less to tell him how much they love him and they love hearing him. I do love him because he saved my son's life one time.
Okay.
And
so I can be a celebrity. So let me intervene right away. So what happened? I die not going to the young people. I can be a celebrity too in my life and they fight.
You don't die yet, but I was looking for you from good in the sense I didn't see you.
Okay.
Your secret outside. I have a question. What happens when your ears don't make so much of that brown wax like it used to in your younger days?
Okay. So a reduction in wax. Okay. We'll take that question. Let's thank you, caller. We'll take that question for the doctor. Let's just get another caller in. Caller, good morning.
Well, it's a troublesome caller. Once my doctor is there, I'll always continue calling. What is the solution for dizziness or whatever it is? Because, you know, Dr. Pascal alone not know the amount of trips I make in his office already. It's just that he wouldn't tell me go back home. Whether I have money or not, he will check Lucille. What is the solution for dizziness? Thank you.
Okay. All right. So, Doc, we have two. Well, we were going along with that, with the second one.
Just remind me to
we'll stick up in on the wax production, yes.
Right. Now, so that's why it's important to make that. Now, there are multiple causes for dizziness. So, you can feel dizzy, which is not vertigo, which is, I mean, by lightheaded, imbalance, feeling like you're going to faint for a multitude of reasons. So that's why it's not really a favorite. The symptom of dizziness is not really a favorite of doctors because of the number of things that can cause it. So you can have issue. And I remember I said that for your coordination and for you to feel stable, you have to have messages from your joints, sensation from your feet or your hands. That's why you use a stick. Messages from your ears, from your eyes, and then your brain coordinates it. So anything that can affect any of these things can make you feel dizzy. So you could feel lightheaded if you have a heart problem because enough blood isn't going to your brain so you can coordinate. You can have lightheadedness or imbalance or dizziness if you have arthritis. Because when you have arthritis, the messages don't go as quickly
from the joints
to your brain. So that's why in the past you'd see most of the elderly people have a stick. That's to help to send more messages to the brain because you might have arthritis of your ankle or your knee that doesn't allow the messages to get to your brain quick enough. In addition to that, your heart may not be as functioning as well as it used to be. Like Lucille is everything changes a muscle. Right. So everything changes as you get older. So then you might have a combination of reasons why. So there are multiple. If your hemoglobin is low, you could feel lightheaded. If your sugar is low, if your pressure is high, because all of these things are affecting your brain. And your brain coordinates all the information to prevent you from feeling dizzy.
Okay.
So if you have issues with your brain, sometimes you could have conditions of your brain that make you feel lightheaded and dizzy. So there are multiple reasons for dizziness. And that's why it's important to separate that from vertigo. Vertigo is a little bit more specific. Vertigo is usually really, even before I go that, even medication can make you feel dizzy. So some of the side effects of some of the medication, you see it's written all the time. It's dizziness. So dizziness is there are multiple reasons for being dizzy, and it's not always your ear. Most people think once they dizzy, something is wrong.
It's wrong with the ear, which is not.
Which I'm not complaining. Good for me.
Good for you. So they'll come to you, but it could be something vertigo, else.
But so I just want to make that point that there are multiple reasons why, and the dizziness there are several causes. Several causes. I mean, you could spend the whole morning here trying to itemize the different things that can make you feel dizzy or make you feel off balance or make you feel like you're going to faint and all. The key to those symptoms is really and truly it depends on how sudden it is, how severe it is, and what's associated with it. So if you have dizziness and it just came on suddenly, you had the experience was what you would call horrible. You almost felt like you were going to die. You had headaches with it. You were seeing double. That type of thing. Persistent headaches, and it's something that's recurring all the time. That tells you something that you need to address, or it's recurrent when it comes to dizziness. So it's not, most of us will experience a little dizziness from time to time. So it's usually is something temporary. Usually it settles. Usually sometimes you're dehydrated. So many things can cause that. Because as I said, it depends on where the problem is. But if it's severe, whether it's dizziness or vertigo, which I'll come to in a while, that's really and truly what is the alarming sign that you need to have some professional
medical
intervention to at least find out what it is. Because you can get dizziness from having a heart attack. You can get dizziness if your pressure is low and you're going to go into shock or something like that. You can get dizziness if your pressure is too high.
Right.
So all of these things, but it depends on how severe it is, and if it's sudden, and especially if it's the first time and it's severe, disabling to you. That is usually, but otherwise, it's something that if it's recurring and you're concerned about it, that has to be investigated fully because there's so many reasons why you could be dizzy. And you're also talking about anxiety earlier. Even a little bit of anxiety can make you feel
dizzy.
You hyperventilate, you feel lightheaded. So that, but again, it depends on the context and the severity of it.
Okay, let's just take a call. Caller, good morning.
Yes, Dr. Pascal. When I had that problem happen to me, I started puking, and I just started. I just couldn't stand up. That I was taken to the doctor, and the doctor was the one that confirmed that I had inner ear infection called vertigo. I don't know what the hell that was at the time, but he said that's what I had.
Right.
And as I said, for weeks, I couldn't walk on my own now to be having somebody with me to guide me where I was going. And I was much younger. That would happen since in 1980 something or so. Yeah. So now and then, as I said, I always sometimes try to be careful, feel a little dizzy, but I say maybe the pressure doing that, so I put myself on that side. But the doctor did diagnose and say it was vertigo I had. Bye-bye.
Okay, so I guess that brings us into Dr. Pascal, because you did say vertigo is a symptom.
Right.
She's saying that she had an inner ear infection, and then the doctor said she had vertigo. So I guess in that instance, the vertigo is the symptom of the infection.
It's always a symptom.
Okay.
It's always a symptom of something going on. Elsewhere, right?
Okay.
So vertigo now, which is really what most people say they have, or most people are concerned about, because lightheadedness and feeling weak and feeling like you're going to faint, usually they are not severe. But vertigo, when you get that sensation that you're spinning and you have no idea of where you are in time and space, it's a lot more what you call disabling and frightening, and what scares most people when they have it. And as I said, vertigo is a lack of orientation in time and space, where you feel the room is spinning with you, or the bed is spinning with you, or wherever you are. You like you're on a boat, you're swaying all the time, but it's the environment that's spinning.
Okay.
Usually. So for me, once you say, most people come in and say that, well, they have vertigo and I need to do something, help them because it's so severe. But I mean, usually after I ask a couple questions, I realize it's not vertigo, it's really dizziness. So, but if it's true vertigo, it's usually related now to usually problems in 4 areas.
Okay.
Usually.
Okay.
So it's usually related to what you would call your balance system. And as I said, your balance system compromises your muscles, your joints, and also your information from your eyes, information from your ears, I'll repeat that, and your brain. So when you have vertigo, it's usually one of these areas that is at fault.
Okay. So the ears,
the eyes,
and
your
joints,
brain and the
muscles.
Joints. Okay.
Yeah, all the muscles.
Okay.
Yeah, because you don't forget, when you walk in, you need your muscles to coordinate.
To
you
coordinate
need strong
the bone
muscles.
movements.
You need, you see. So it's that information from the muscles moves the joints, and then the message goes to your brain.
Right. Okay.
So vertigo now, it can be an abnormality in one of these areas, or in 2 or 3 of them at the same time as well.
Okay.
So you can have conditions that affect your brain that will give you vertigo. For example, if you have infection, inflammation, you have tumors in your brain, that type of thing can give you vertigo. Okay. If you have conditions that affects the balance, the nerve of balance in your ear, or the balance in your ear has organs that we call balance organs. So if you imagine it, those balance organs function when you turn in. So if you want to turn in, you don't want to be turning and feel like when you turn in your head, you're standing just looking to the left. So it's information that goes from the balance organs in your ear that's functioning there. So they'll be opposite to keep you standing. But if there's issues with the balance organ in your ear and one side is giving a certain amount of information and the other side is giving information that's not equal and opposite, then you feel you have vertigo. Then you get vertigo.
Okay.
So whether it's the balance organ in your ear that's at fault, or whether it's the nerve of balance from your ear to your brain that's at fault, that's disruptions in these can give you vertigo.
Okay.
So that's why commonly, if you have vertigo, if you are really true vertigo, let's put it that way, then maybe 60% of the times it's usually related to something going on in your ear.
So doctor, if it is related to something going on in your ear,
that's not compensated by your joints,
right, or
and
the
your eyes,
or the muscles,
or
the
yes,
brain,
and your brain.
Okay. How would you be able to figure that out, or does it even matter in what you're going to use to assist the patient? How do you determine what's the root?
Right. So that's where the important thing is to now. That's where the taking a history of the patient and finding out what exactly is happening to them. So most of the patients actually get fed up with me when they want to tell me they have vertigo. I says, or they're dizzy. I say, well, no. Tell me what is happening to you.
Okay.
They say, no, I am dizzy. I say, I don't know what you mean by dizzy, because dizzy could be anything. So it's usually what is happening to you. So so the history of what exactly is happening, how long it's been happening, the severity, and all those things will give you an idea. Also in the history, whether they have had any problems with their ears before, with their brain, arthritis, all these things is information you collect. So when you collect that information, every bit of information helps you to narrow down where is most likely the problems coming from.
Okay, so the history.
Okay, the history.
Okay.
Yeah. And then the examination of the patient. That's why I'm saying most doctors, even me, myself, sometimes when it's dizziness, you just know, well, you better tie your waist because you're going to have to eliminate so many
lot of things.
Right. So then the examination helps you to do that. And certain things you find on the examination will tell you whether it's most likely the air, whether it's contribution from the patient doesn't see well. For example, something simply like feeling you off balance or giddy, or you have the spinning when it's dark, tells you that's a problem most likely.
With the eye.
It's because your eye is not giving enough information to your system, especially if you're older, to help you to orient so you feel. Okay. So the examination now will give you. So when you examine the patient, obviously part of it should include examination of the eyes and of what we call your muscles and your joints and your nervous system. And so it's by that examination you will zero in. Well, it's nothing to do with arthritis. It's nothing to do with blood pressure. It's nothing to do with something going on in the brain. It seems that from what you've picked up or what you've excluded, then it's most likely something coming from your ear.
From the ear, okay.
So you will find that you might be asked to walk with your eyes closed. You might be asked put in certain positions, because one of the commonest conditions I see with people with vertigo is what they call vertigo when they go to lie down on their beds.
Okay.
So you call that positional vertigo. So that's maybe a diagnosis, because it's not vertigo, it's positional vertigo at the end. Because what it is that they can almost tell you, like, when every time I lie down, every time I turn in my bed, the room is spinning, the bed is spinning. Okay, so that's usually, so now during the physical examination of the patient, you can then provoke it by a certain test, by putting them to lie, and then you look for different signs in their eyes and stuff like that. So that's how you know. Okay. So that's how you can zero it. Also, while you zero in whether it's the air, it's whether you have any other symptoms in the air, whether it's happened before, whether you have pain in the air, whether you've had an infection in the air recently, whether you have problems hearing, whether you have ringing noises in your ear. So all of those things, whether they're present or absent, will help you to know whether this is most likely related to a problem originating in the air. And then after that then you can do certain examinations now to confirm or exclude whether it's really an ear problem.
Mm-hmm. It's interesting how investigative the medical process is, yes. So the doctor in that case is like a real private, a real detective.
You have to, especially in dizziness and vertigo. Mm-hmm. Yeah, dizziness and vertigo is one of those symptoms that really and truly could really tax you, and especially depends on the patient. If the patient if it's a young 20-something-year-old patient without any other problems, that's pretty straightforward. Mm-hmm. But it's when you have somebody who is elderly, who have other illnesses, hypertension, diabetes, which makes it more difficult to maybe not to treat, but to zone in on the cause.
To figure out what
you can give them a diagnosis. That's not saying vertigo. Mm-hmm. That's at least you can get them there. You can be. It's important because the treatment, it's usually, most times, the treatment is just like a treatment for headache. It's not. It doesn't address the cause. Yeah. It addresses the symptom because this person just doesn't want to feel. So it's one thing. It's great to find the diagnosis because you can then treat it. But several times, because I said there's so many causes, then you have to end up just treating the symptom and letting the patient understand that this is just for the symptom. So I'll just mention it here because that's a lot of patients get diagnosed as vertigo and they get treatment with medication for vertigo. Mm-hmm. But it's only treating the symptoms. But because it helps the symptom, they end up continuing on it. Even without the prescription, they will get it, or go to another doctor to get it, or because they say this is what helped me. But that's all it did. It didn't. It was most of the medication is just to help you with not having this terrible feeling of going to fall and faint. Mm-hmm. So most times, and I just want to mention it because most times I see patients now who've had vertigo for years and whatever, or for a long time, and we come and say, well, whenever I feel it, I take the tablets, or I'll be taking the tablets for 3 months, and really and truly. But the issue is that is maybe not appropriate, because what happens is that, don't forget, there are several reasons why. So if you have a problem with your eye, and let's say you lost your eye suddenly and you can't see, and you have a problem with imbalance or equilibrium, then after a while, your ears, your joints, and your brain will compensate for that. But if you're taking these medications, that is just to treat the symptom all the time, it prevents you being able to adjust and what's the word? Adapt.
Right.
To the fact that you've now lost your eye, or have a problem in your ear, that initially caused the problem.
I'm really glad you said this, because we get a lot of customers who come for repeats, and we have to explain to them, this was for 2 weeks.
Yes.
And, to treat X, Y, and Z. Sure. And they're telling us, you don't want to give it to us, and I have these issues. And it's really important to understand sometimes that some medications are not meant to be lifelong and perpetual. It's to treat the issue. If you're still having the issue, sometimes it's worth going back to your doctor and seeing, investigating, like doctor said, what might be happening with you causing that.
Yeah, that I think that's an important take home for the listening public, especially when it comes to dizziness and vertigo, because what you're doing is almost ensuring that you remain handicapped by this thing, and also taking some of the medications all the time, they do have. Then you end up with side effects, and then you blame the doctor for giving you a medication that ends up giving. Well, you were taking it all the time.
Exactly.
You only supposed to take it for around 5 days or a weekend just to help you. And so I think it's a very important take-home message for the listening public that who think who have vertigo and taking it helped. And it's important because I have to remind the patient sometimes that when I give them something it's just to help them to stabilize. It's not that treated the problem. It's the other causes that maybe the air problem in the air, reposition. What we call, there's a technique that we have sometimes to do to reposition the balance organ in the air. That is, but even if I do that, most patients still think it's a tablet. The tablet was only to help them for 2-3 days to feel okay, so they're not having nausea and vomiting, and every time they move, they feel bad, or they feel they want to vomit, nauseous. So that's what the medication.
You mentioned the repositioning technique. In my research, I saw a lot about that. So in terms of that, and I think that's something that persons don't understand as well, you can reposition to get those deposits back where they need to be. But it is that it can occur again.
It can reoccur.
Right. And then some people think that, we did this and look, I'm having this issue, XYZ. Yes. So you just assume you need the meds or, it's not working. But sometimes, I guess, like Doctor said, there's different reasons that you get vertigo. And some of those reasons, they can come back. It's like almost like a flu, so you can get it again.
You're quite right, because even the common one that, maybe I should say, I like when patients come to me with it because I know I can do something. I don't just have to treat the symptom. But it can recur, and it's usually because of there are little crystals in your air that can get out of place. Okay. So if you got out of place because you hit your head 10 years ago and you get out of place now and causes you the vertigo, it can recur because there are several of them. And so sometimes even we have to remember to tell the patient that it can recur. Because a lot of times the impression is that, especially what I call for the vertigo that happens when you lie or you turn your head quickly, the positional vertigo, it often will recur because the cause of it, again, was years ago. It's just that as you get older, the same way Blue is saying that all of a sudden, as you get older, the things don't work as well as they used to. So sometimes the reason you're having it now is because you used to have ear infections as a child. It's because you had a head injury in an accident that gave you whiplash, that now these things were shooken up then. You were because of you were young, your brain could cope with the thing, but right now it's not as. So that's very important for people to understand that.
And that leads, because we've mentioned age now twice. Initially, you said, if it's a 20-something-year-old, it might be easier to determine what is the cause compared to the older person who may have other reasons. Now we're talking about if something happened in your youth, it might be causing this in the later days. Are we saying then that these issues that may result in vertigo are more pronounced or prominent or seen more in the older population? Is that what you see, or is there an equal balance in effect?
No, the complaint of dizziness, which would include vertigo, is a lot more common in the elderly population. And it's for the simple reason, as I said, they have arthritis, they have weak muscles, they're not seen as well, their ears not functioning as well, and their brain may be affected by other things, the circulation to the brain from hypertension, diabetes, atherosclerosis, all of those things. So it's usually it's much more common in the older population.
Okay. And Doc, if someone, because I'm interested in the positional vertigo that we were discussing, someone has had the experience of certain positions triggering this imbalance, if they lean back. If they, different positions, and as you mentioned, the bed lying back and so on, and that starts to impact what they want to do, because they're afraid to experience it again. Yes. What is your advice on that? I mean, I do know of people
that can correct it with the understanding that it doesn't mean it will not happen again. It's the same way if you break your leg and they fix it, it doesn't mean it can't be broken again. In the same thing. So I think that's very important, and why that's important is reassuring to know, at least for the positional one, that can be fixed, at least maybe for a long time, and maybe never recurs. Because even if I'm seeing you because you've had positional vertigo, the patients who've seen me for that's one thing they will tell you, is that I tell them, well, I can't tell you what it is. I can't be sure, but I have to do a test. But the test will make you feel like the episode.
You have
But the trade-off is that if the test is positive and you really feel terrible, that means I can help you.
Right.
If the test is negative, well, you have a problem.
Okay.
So it's that kind of information that patients need to understand. But again, they have to make the differentiation between what is really, it's not vertigo as a symptom. It's vertigo as something is causing it. Vertigo.
I see we had a caller. You can try again. We are quickly approaching the end of this show. Let's take this call. Caller, good morning.
Yes, good morning.
Good morning. Good morning.
Greetings.
Dr. Pascal.
Greetings.
And good morning to the young lady. I cannot
Leona.
I just want to say what a great program this morning. Very educational. But I have a question for Dr. Pascal. I have a little problem in my right ear. Sometimes it rains, and I have to put a little coconut oil to help it. So I want to find out what is the reason why I'm having that ringing session in my ear. And good morning and thank you. Very educational program.
Thank you, caller. So the question, Doc, and then we did have another one, and I see another one on the live stream. So we'll take those 3 questions so that we can wrap up. So this caller is asking about a ringing in the ear.
But you know how the old people say, people talking about you.
Your ears are ringing.
Somebody. No, ringing in the ears is a fairly common thing, and it's really related to either stimulated of the nerve of hearing from the nerve of hearing, because, for example, one example is that if something is touching your eardrum, you can experience it then as ringing in the ear. So, for example, if you have a lot of wax in it goes back to that wax thing. It can, and if it's touching the eardrum, it then sends a message and you hear it as ringing. So, but usually ringing in the ear is usually a symptom of damage to the nerve of hearing. So you'll find it again much more common in the elderly population and our people who, especially those who've been exposed to loud noise, that's damaged their hearing. Because when you 20-something and you go exposed to loud noise, the following morning for a while you're not hearing well, but you have ringing in your ear. That's because there's been damage to some of the cells on your nerve of hearing. And also, if you're elderly, and your nerves, the cells of hearing are not functioning as well as they used to, the experience of that is ringing in your ear.
Ah, okay.
So ringing in your ear can be caused by several things. It can be caused by infections and all those things, but it's usually just an indication that there is damage to the nerve of hearing.
Doctors, you said that that means there's permanent. Sometimes it can be permanent damage. Yes.
Yeah, usually that's what I'm saying. When you go out late at night and you loud noise, the damage is temporary. That's why it comes back. But sometimes the damage is permanent.
It's permanent.
So the ringing becomes more or less permanent. And usually you hear the ringing is worse when things are quiet. So we think the ringing is always some to a certain extent always there. But when things are quiet, you hear it louder. Or when your hearing gets worse, you hear it louder. And but if it's loud and it's troubling and it's getting worse and your hearing is getting, it needs to be checked as well.
Okay.
So it's not always something simple like wax or something like that. But usually if it's loud and it's getting louder and you're having issues with your hearing and you have problems with balance, and so it could indicate other problems of the nerve of hearing. So that usually needs to be investigated.
Needs to be checked. Yeah. Okay. I'm guaranteeing this is the last call. It's 11:30 and we have 2 questions left. Let's just take this last caller. Caller, good morning.
Dr. B.
Greetings.
Can gas cause that to gas? Wind.
Can what? Can what?
Yeah? Wind.
Uh-huh.
Can it have that same effect on your ears? Did it go up in your head?
What, wind?
Yeah.
On the noise?
Yeah.
Well, I suppose anything is possible, but it's unlikely because your ear always is exposed to wind. Always there's air in your ear. People sometimes say they feel the air, there's air in the air, but you always have some amount of air in your ear.
I just want to know.
Yeah, I don't think so. I wouldn't. As I said, I don't know. I'm not aware that would be a cause of it.
Because sometimes when everyone you just block your hearing too, you know.
When what?
Yeah, when in your head it just block your hearing sometimes.
Well, no, I know you feel it as air, but it's not air.
Okay.
Yeah, that's how we can express it, but it's really not air that's blocking your ear. It just feels that way.
Okay.
All right.
Thank you, caller. So let's take the question from earlier, Dr. Pascal, as it related to the wax and the change of wax production with age. That was a very early question. I promised to come back to it. So before we close, I want to take that, and I want to take that one question from the live stream.
Yeah, I'll just take the opportunity to say a little thing about wax. Wax is produced by the inner part of your ear canal for protection. And it works its way out from the inner part and comes out. So now the nature of the wax depends on several things. It depends on your health, your state of health. It depends on your skin type. It depends on whether you interfere with it, sticking Q-tips and hairpins trying to clean it, which you cannot do, which I will say again. The only thing that's supposed to go in your ear is your elbow, if you can achieve that. So there are several reasons why you could find that the wax has changed. But it's not usually an issue. It's just that sometimes the cells, sometimes you're not hydrated enough, sometimes you're not functioning enough. Sometimes you're not, you're cleaning too much and those types of things. So it changes the glands that produce the wax. They change in character. So I don't think it's not anything I would think is anything alarming.
Okay. And then the last one I wanted to take was a viewer asked about head nodding, a persistent head nodding, and the relationship with the experience of vertigo.
Right. Now, well, if we go back to it, don't forget your head is not nodding all the time. So if your head is nodding all the time you're sending messages to your brain from your ears and from going to the muscles and the joints in your neck. So that's why. So if you have arthritis in your neck and you're nodding your head all the time for whatever reason, then those messages not going to go to your brain in a organized, synchronous way, and then you could have problems. So even arthritis of your spine is a cause of imbalance and vertigo.
Okay.
So if you have head nodding, which means all the time something else is causing that head nodding, and in those situations, sometimes what helps is just a simple thing like using a collar to support your neck, so it prevents
from nodding.
From nodding.
Okay. I see our phones are going, the lines are going, Dr. Pascal. I did know that you were going to be a popular guest here on Health Vibes. And as I had said at the start of the show, this is a topic that we've never spoken about. I do see that we have some questions we did not get to take. I'm seeing the question on menopause and its interference with possibly vertigo. So we maybe, Dr. Pascal, we have to schedule a follow-up because it is 11:35 a.m. We are out of time on the program and the lines are still going. So we need to have a follow-up show.
Before we close though, I'd like to tell our listeners, we mentioned the possibility of less wax production when you get older. But if you do have the issue of excessive wax in the ear, then obviously no Q-tips, no hairpins, you get that clean professionally. Or if there is excessive wax buildup, you can get products like the olive oil ear wax, the carbamide peroxide ear wax, as well as some people have a water issue. If you get swimmer's ear, deal with that as well. You can get something to do that. And we have those as our products for the week.
Yes.
So you can check them out on our Facebook page. That will give you a bit more insight as to what they do and how they can help with excessive wax. And if there's water in the ear to prevent infection before it gets to that point.
Right. Yeah. I recommend that instead of trying to remove the wax, you just soften it with those products,
so
and the wax will come out by itself.
On its own, right?
At least.
If it's more difficult, of course, book an appointment with the doctor. You can get it cleaned.
Yes. So products of the week are on the Facebook page, and of course in store you can check them out this week. The QC Ear Relief Drops, the QC Ear Wax Removal Kit. Those are the two products of the week. But Dr. Pascal, it was a pleasure having you on the program. I thank you so much for gracing us with your time and your presence, and your fans who called in. I know they were happy to hear you. You said it's been a while since you've been in studio, so maybe you need to come back in short time. But thank you so much.
Welcome.
And we're signing out here from Health Vibes. My name is Trudy.
My name is Leona.
And we will be, hopefully, God willing, back with you again next week, Wednesday, with another program where health gets a little vibes. See you next week and take care.
Oh, and if they say convenience will make a big difference, then you can trust me.